Hello, I'm Dr. Finnell from Finnell Chiropractic, and today we're going to be talking about a stabilization exercise that I think is important for all my patients and anybody that wants to have stability in their lower back. We've all been taught that it comes from your core, and everybody thinks their core is their abdominal muscles. And while that is your strength muscles for your core, that is your strength muscles for your trunk of your body, it's not the stabilization muscles. So the stabilization muscles in the spine are located right next to the spine. In fact, they attach to the spine. Here you have an inner spinous muscle. You have two intertransverse muscles. You have two rotator muscles, and then you have two multifidus muscles. Those four muscles make up the stabilization muscles in the spine. Now, there's two really good ways of working that. Number one, swimming. Swimming allows your spine to be in an environment of no gravity, and basically your back is twisting, it's undulating, it's doing all the movements that it's going to work those muscles. However, some people don't like to swim, they can't swim, they don't have the ability to swim because they don't have a pool near them. So today we're going to show you an exercise you can do in your living room with an exercise ball. So make sure, number one, that you have an exercise ball that is your size. I'm 5'10", so I need a 65 centimeter ball, which we have here. And what we're going to do with this is we're just going to sit on it to start with, right like this, okay? And you want to start with your feet apart, okay? This should feel very nice and stable, but what I'm going to have you start doing is start moving your feet together, okay? As you move your feet together, you now become more like a bicycle rather than a tricycle, so you have to start using some of those core muscles to stabilize you as you're sitting here and balance you, okay? The next step you're going to do is the crucial one, okay? You want to make sure that you're nice and stable in this position, and when you are, you can then just lift a foot. Okay? By lifting a foot, you're going to recruit those four muscles in the spine to keep you balanced, okay? Along with your abdominal muscles as well, okay? Now you do that for 15, 20 seconds, go to the other foot and get nice and balanced there. You can see it's not necessarily the easiest, okay, to do, but you work your way up until you're doing about 60 to 90 seconds with each leg up, okay? And then the next step, and the last step I'll go over today, and that is just the next phase of this exercise. When you get really good at just sitting there on the ball, lifting one leg up, holding it there for 60, 90 seconds, no problem. Then what you're going to do is you're going to scoot down so that it's in the small of your back. Again, starting off with your feet out wide, and what you're going to do is you're going to work them together until you get them really close, okay? And again, once you get nice and stable here, then it's lifting up one foot off. And you can see it's harder to balance, okay? And again, you want to work your way up to where you can do that for 60 to 90 seconds on each foot. Before you start this, if you are a patient of mine, please ask me about it. And if you're not a patient of mine, please ask your doctor or whoever you see for health care. If you don't have anybody, please come in and talk to us. And that's it for today. Thank you.